Have you
Oh,
got
good
your time?
evening.
Hi.
Yeah.
Thank you for coming. Okay, my background, as you're aware, is mental health nursing, and I totally take on board what Michelle has done and the hesitancy towards it. But I'll be talking about mental health now. Now, we've seen the pandemic. We know it's caused a lot of confusion. It's affected individuals' physical health as well as those suffering from underlying health conditions. Now, they're vulnerable to the COVID-19, and this has been proven by various research and the death toll mortality. So we have to be aware of that when we're considering the vaccination to have or not to have. Psychological health, it's had an impact on that. It's looking at the emotional elements, the social element, but also the spiritual element, which we've used pre-pandemic to help cope with situations. Now, we've seen an impact whereby there's an increase in mental health for young people, but also ethnic minorities. And as we know, when they're in the mental health services, the way they're treated with being sectioned and having adverse reactions to the medication that's given, because it's usually given at a higher dose. So I'm thinking about that when I'm doing this presentation. Environmental, it's been stated that majority of ethnic minorities are front facing, so they're likely to have contact with individuals that may have COVID. And also they're likely to lose their jobs as well, which will have a financial impact on how they will look after their children, pay mortgages, etc. COVID once again has had an impact. As a community, we like to meet, we have family, friends. This has had an impact. Once again, it's going to have an impact on the mental health. Social isolation if you're vulnerable. Social isolation due to COVID. This is all having an impact on mental health. But what we've seen from the COVID-19 is disadvantaged groups, which majority are minority, ethnic minorities. It's been highlighted that they're more likely to have a higher mortality. And we're seeing the inequality that the COVID-19 has actually shown. Can we move on to the next slide, please? We move on to the, okay. So next slide, please. Next slide. Okay. So emotional health. Stress has gone up. It will have an impact on the physical health. So it's going to lower the immune system. You're going to have headaches. Your physical health, such as blood pressures, diabetes, will all increase that stress. It's going to have an impact on the way we think, our emotions. Okay. It's going to lead to anxiety, fear of the unknown, leading to poor concentration. It may have an impact on your sleeping as well. Mood swings, agitation, etc. Now, so you're stressed out by the situation, leads to anxiety, and then depression. Depression is, as I said, sense of hopelessness. It's going to have an impact on your self-confidence, your self-esteem, but also planning for the future and moving forward. Individuals may withdraw, social isolation. And this we're actually seeing, I'm in Birmingham, we're seeing this, and it's affecting younger people more so than adults that have had jobs that have been furloughed. So they're having some sort of money coming in, but it's younger people trying to plan for the future, trying to get jobs. So this is having an impact, as I keep saying, on the mental health, and it's the mental health. I worked in the early intervention service, and I tried to prevent young people from coming into mental health service. So can I move on to the next slide, please? Social health, fear of social situations. So you may not want to go out because you fear COVID, you haven't had the vaccination, because you've decided not to, based on all the medical history that we've had of abuse. And we understand that hesitancy. Juggling work and schooling, that's going to have an impact on our health. Children not going to university, as we saw last year, most students had internet teaching, which for myself, I know had an impact on the students that I actually talked with when I was on Zoom meeting, because they weren't able to see friends, they weren't able to socially mix with others. And as I previously said, there's a high mortality rate of ethnic minorities due to COVID-19. And this is basically based on the deprivation that our community has lived in. Can I move on to the next slide, please? So the choice to have the vaccination or not. Michelle clearly stated that there's been abuse over the past. We've had the custody experiment. We've had the Depo-Provera contraceptive, which was used in Africa and African women, which then made them sterile because they put it a much higher dose. And then they titrated it to the dose that's been accepted now. So once again, Africa has been used as an experiment. You've got Henrietta Lacks. Her cells were taken without her permission. So she didn't give informed consent. And it was used to isolate the cure for cancer. So many of the cancer cures that we see, it's from Henrietta Lacks. And you can look that up. So once again, we've seen abuse. For me, I've had the vaccination, and I'll tell you the reason why I've had it. I've looked at it and I'm thinking, if they're having it, the indigenous white population, then I'm going to have it for the reasons are that if it's not sort of an isolated group of people having it, everyone's having it. But it's ensuring that it's the right vaccination. So when I had it, I did ask to see the vial. I did ask for the number of it. And I did ask to make sure that it was the one that I thought I was having. So, but it's utilitarian, greater good. So you're not only protecting yourself, but you're protecting others. The choice is open to everyone. The choice is yours. And yes, there has been abuse. But hopefully, Black people, as we're becoming more educated, we're more informed, we're going to ask questions. So can I move on to the next slide? I did mention the custody experiment. Okay, as I said, my background's mental health, developing resilience. What I've seen in Birmingham is that there is an increase in mental health. And I think there's 1.6 million people on the waiting list for mental health. And the majority of those tend to be from Black people because they're at a disadvantage at the very beginning. They don't have the jobs that would allow them to work from home. So they're worried about their finance, which is going to have an impact on their mental health. So developing resilience, this is a website that I hope people will go on and use. It talks about coronavirus and well-being, anxiety, lockdown, long-term conditions, jobs and worries. Because what I do not want to see is that increase in mental health continue to rise for our young people. We've had a lot of suicides from young people, Black youth committing suicide because there's lack of jobs. Their educational prospects has been dampened. Then, there's so much that, families are worried about. So, can I move on to the next slide? Is there a next slide? Okay, that's okay. That's a bibliography. But as I said, yes, we've had abuse of the past, but we have to think forward. We know our past, we must never forget that. And we know it will continue unless we speak out. But what I'm glad Michelle brought about is that it acknowledges why the ethnic minorities are very hesitant to have any form of vaccination, any form of medical interaction, because we're aware that heart transplant, they used to, in Africa, used to use Black people to see how it works. The experiment again in Africa, and that's continual. But for me, I'd say have the vaccination because it's not in isolation. Everyone's having it. but it's for you to ask to see the vial, where it's coming from, and ensure you have those details and write it down. I think that's the end. Hopefully I've stuck to my 10 minutes.